Welcome back. My name is Dr. Carl Baird, and today I'll be discussing one of the most common hidden causes of knee and lower back pain that often gets left out of traditional treatment plans. But if you're somebody that's been struggling with knee and back pain that's not responding to traditional treatment, it might be worth it to look at this particular joint. So, without further ado, what is the cause? It is your ankle joint. So the ankle contributes to both knee and lower back pain in a few ways. First, it can directly cause more impact at your knee and at your lower back by being unable to absorb what are called ground reactive forces. So each time you take a step, there are forces that get transferred up your body from the ground. And so what happens if we're missing ankle range of motion, or if we have tight and stiff ankles, instead of being able to absorb that force, so if my hand is my ankle here, ideally, when we take a step, it's nice and smooth, and our body can absorb those forces, and there's not much impact that gets transferred up the leg, into our knee, into our hip, into our low back. But what can happen is if you have stiff ankles, instead of absorbing that force with each step, it's more of a slap like that. And so a lot more force gets transferred up your leg, which can contribute to both knee and hip and lower back pain. Stiff ankles can also contribute to knee, hip, or lower back pain indirectly by what are called movement compensations. So your body is very smart, and if it lacks a range of motion in one joint, it can still perform the movement by changing the way it moves. But what this does is it oftentimes puts a lot more impact on joints that weren't meant to take such an impact, like your knees and your lower back. So there's plenty of examples of this. The squat is the easiest one to demonstrate. And so again, if I'm going into a squat and I have limited or stiff ankles, to get into that squat, what's going to happen is my body's trunk is going to fall forward. Now, if I'm doing a lot of reps or have a lot of weight, that's going to put more impact on my lower back, which over time is going to contribute to more lower back pain. So now that we understand a little bit more about how stiff ankles can both directly and indirectly lead to more knee and lower back pain, it's important that we figure out if this is a contributing factor for your knee or low back pain. Remember, everybody's body is going to move a little bit differently. Some people are going to be very stiff, some people are more flexible. So it's important that we first take a few measurements to see if our ankles are stiff in the first place. I'll show you how to do that next. Before you go scouring the internet to find a bunch of ankle mobility exercises, it's important to determine if ankle mobility is actually a contributor to your knee and back pain. Because remember, everybody's body is a little bit different. There's going to be people that are more flexible, less flexible, and so we want to make sure that ankle mobility is contributing so that we can make sure we're focusing on the right things for your program. So to do that, what we're going to do is use an app on our phone. I have an iPhone. I'm pretty sure you can find a similar app on any phone that you have. But on the iPhone, it's called the Measure app. I'm pretty sure it comes with your phone. If not, you can go to the App Store and download it for free. It's just called Measure. And you're going to click it. And then on the bottom, once you're in the app, you're going to switch over to the level. And so what it looks like is a level. It's handy if you're a handyman as well and you need a quick level. But to measure our ankle mobility, what we're going to do, we're going to get in the lunge position. For this one, we want to make sure that this back leg is closer to the knee. We just don't want our hip flexor to be the limiting movement when we come forward like that. And what we're going to do, once we have our level open, we're going to put it on the middle of our shin, and then from there, we're just going to drive our knee forward, going as far as we can. We want to make sure that our heel stays on the ground, so you don't let your heel come up. Drive that knee as far forward as you can, and go ahead and take that measurement. So I'm right at about 41, and you want to make sure that you do it both sides. And so what you're looking for is can you get to 45 degrees? 45 degrees is kind of the baseline. That's how much ankle range of motion that you should really have. So again, I was on the low side. I know I have tight ankles, which is why before all of my warm-ups or workouts, I include ankle mobility exercises as part of my warm-up. The other thing that you want to look for is differences side to side. So what you might find is that both sides were above 45, but one side was at 50 degrees and the other was at 42 degrees. And that can still be a problem. So if you have a big difference side to side, you're going to want to even that out so that we can limit impact on your knees and lower back. So if you did this test and you found that you're either below 45 degrees or there's a big difference side to side, then improving ankle mobility is going to be a good strategy for solving knee and lower back pain. And that's what we'll get into next, some great exercises to help improve ankle mobility. Now there's two things that can limit ankle range of motion, and we want to address both. The first is going to be the ankle joint itself. The second is going to be tight calves. So we want to have a strategy to improve both. Let's start with the ankle joint. The first exercise that we can do is very similar to the test that we just did. So we're in this lunge position, and all we're going to do is push that knee as far forward as we can. And this time you want to hold it at the end and apply a little overpressure. So I'm putting a little pressure down on my knee, and I can really feel that stretching right at the front of the ankle here. So what you do is you come forward, you want to add a little overpressure, really try to push it as far as you can just for a few seconds, and then you can back off and then sink into it. Again, trying to go a little bit further each time. You sink into it, add a little overpressure, and come on back. So that's targeting the ankle joint itself. You should feel it right on the front. The other easy exercise to do more of a calf stretch is simply a downward dog, which you might have seen before. But what we're going to do is just get in the high plank, shift our hips up. You can walk your feet a little bit further forward, and then all you're going to do is pedal out your feet, trying to bring your heel to the ground. And again, you're going to be stretching. You should feel that stretch in the back of the calf right there. And lastly, one of my favorite exercises to improve ankle dorsiflexion that targets the ankle joint itself are called eccentric ankle drops. So to perform this, you're going to need a yoga block, or you can just use a stair as well. But what we're going to do is we're going to start on our toes. So we're going to press up off our toes on the block, and then we're going to slowly lower our heel down. As our heel sinks below the block or the stair, we're going to bend our knee down here. And so you're going to really feel at that same area, the front of the ankle. You're going to hold it for a second or two, and then you can just reset. But again, you can really feel it in the ankle if you have tight ankles like myself. So all you're going to do, then reset. Start with the toe up and lower the heel down. Make sure you bend that knee. If you keep a straight knee, you're going to get more of a calf stretch. But we really want to target the joint with this one. Hold it for a few seconds and reset. So there you have it. If you're somebody that's been struggling with knee or back pain that hasn't been responding to just the traditional treatments and you're looking for other causes, I hope this helps explain how looking at the ankle could be that missing piece, and also give you a few strategies to improve upon that missing ankle range of motion if it turns out it is a contributor to your knee and lower back pain. My name again is Dr. Carl Baird. As always, if you have any questions, leave them in the comments below. I'm happy to answer them. Thank you so much for watching. Hey, it's Dr. Baird here. Don't forget to subscribe to our YouTube page to catch all our videos designed to help you build the strength and confidence to live active, healthy, and happy lives. You won't find it anywhere else.